fantastic paints and how we hide them. I'm not Chris.
And I'm not Karina, but in 4K.
And we're here together. As usual. But
Yep.
not as usual because it's a birthday.
Oh, yeah, it's my birthday.
We're celebrating.
No, we're not.
It's Chris's birthday.
People are saying nice things to me, though. You know.
Say nice things. You know.
It won't matter. This is in the past now. It's not
Say
my
nice
birthday
things
now.
retroactively. I don't know. But yes, we are in 4K. We have our full upgrade.
Yeah.
Which is crazy.
Studio
so
4.0.
Studio is like, it's a pro studio, and I don't know what the heck I am doing with my life right now.
Yeah.
It's very strange, but really cool at the same time. So we'll have to give you guys a backstage peek at some time.
Yeah.
At some point.
Oh, yeah.
But
You got to do the new tour.
This is cool stuff. Oof.
We're also joined with a guest.
We are. Crystal is. Okay. So explain what we're doing
So,
within our Discord.
Right now, we're just in the Discord in a stage.
Mm-hmm.
So we're recording this, and we can have an audience of people that can listen in, and then they can participate by raising their hands with like a button.
Yep. And then we can move them in to speak, and then move them back into the audience,
Yeah,
which
so
will be really cool.
We can have an actual conversation.
Mm-hmm. And thank you, Crystal, for our topics of the day. We kind of had some good like little bits.
Yeah, this brought it together.
But I
though.
think we just glued it right together. It's perfect.
Yeah.
So, should we start off by where they can find us?
Oh yes. Let's see. We're on YouTube.
Mm-hmm.
We're in glorious 4K on YouTube.
Ta-da!
We also have our Podbean, which I'll remember this time. Spotify and Amazon Prime.
Mm-hmm.
And some other
Google
ones.
Podcast.
Yeah, Google accepted us, I think.
Maybe.
But not Apple. Never, ever Apple.
Never Apple. They're too persnickety for us.
Yeah, it's a pain.
Yeah. So, you can also find us on TikTok, where you can find some of our fun stuff. There's some silly ones in there that I just adore, but maybe it's just us. You can find the sibling glory, is what I'm saying.
Yeah, it's good. I'm proud of those.
And then, of course, we have a Discord full of wonderful human beings who I can't say I love enough. So go check that out. You can find that in the description as well.
Yep.
Sweet. I think we did it. Look at us getting all in sync.
It's the pro setup.
Yeah.
It makes us too pro.
I know. I'm like intimidated by my own setup now. It's very strange.
I spent the last week in this room just to get used to it.
Getting to know all of your equipment.
Exactly. I had to learn how to use the soundboard, the camera. It was driving me nuts because it was like grayed out. Like last week's episode, I had to color correct a ton.
Yeah.
And then put it in focus. But now I don't have to do that.
I had a miniature crisis of like, oh my God, is that what I actually look like?
Me too. Because our colors are way off.
I was like, why am I orange and yellow? And I don't understand. Like I have some yellow, like undertone.
No, but you were very
I was,
yellow.
like,
you were
very
jaundiced.
Orange and yellow, and I was.
And I was the newborn.
It was
bright pink.
Scary. But now I know what I look like.
Yeah.
Sort of.
Well, it's better, right? You're like,
yes.
We compared it.
No, we're much better by far. Excuse me, we're still both getting over being ill.
This thing takes forever to go away.
Yeah, it's just clinging on. It's really heavy. So our voices are a little jacked up, and we will be coughing periodically, so I'm so sorry. You will have to deal with that.
If I have the time, I'm going to go through and bleep every cough with a sound effect, so look forward to that.
It has to be dolphin noises.
That would be one of them, yeah. I already have a folder full of dolphin noises from my old channel. So it'll work.
Fantastic. I love it. Every cough, we're going to censor. We're going to really confuse the algorithm if we do that. I'm going to be like, wait, what?
Are they
what is
swearing?
happening?
What?
I'm lost and confused. That's okay. Us too. So I think it is time for the weekly recap.
Check in.
Woohoo.
Yeah.
And it's not been a good week.
For anybody.
At all, ever. It's been kind of awful, actually. I don't even remember what happened right after. Yeah, no. This like ate my whole memory.
Yeah.
So I worked. And that was a thing.
We hung out a few times.
Yeah. We had to reshoot.
Yeah.
That was one.
It was worth it though. Reshoot was good.
Yeah, the reshoot was good. And then some of our stuff came and we started season 4 and that was fun. That was last week. I don't know where we are. I have no idea what happened from like Monday to Wednesday.
Yeah. No, me either.
Not a clue. I wound up having to take Thursday off work. Oh, it's because work was so difficult. And when I kept trying to be like, I really just really wanted us to be able to go to Iuds in the afternoon.
Yeah.
That's what I wanted out of my life. Look at this. Well, I found it. I really wanted to go to Iuds in the afternoon, but it has been so unbelievably hot here.
Yeah.
And POTS has just been so bad. So every day, like, I go outside and then I come back in and I'm like, now I need a 40-minute nap.
Oh my
I need
God,
to
yeah.
lay on the floor and try to cool down and pray to God I can regulate my body temperature because I can't move. So that was rough. And then we had kind of a family crisis that was...
Several family crises.
Oh my God.
All
it
at
never
once.
stops. Yeah, all at once. And by all at once, I mean like literally all at once. It was in like a span of 2 days that everything dropped. Because, you know, when it rains, it pours. And because we're psychically linked, it all had to pour between the two of us.
Yeah.
It was great.
Oh my God, so much family drama.
Yes.
Oh my
So
goodness.
I had a familial crisis that started Wednesday and didn't end until yesterday.
Yeah.
And then finally everything is like cooling down to a point where I'm like, I can take a deep breath and rest. And my husband was super, super sweet because after it all ended, he let me sleep like all of yesterday afternoon.
Right.
I was so tired. I think I slept from like 4 o'clock to like 9 p.m.
Right.
And then I woke up at 9 p.m. and then I was like, I don't know what's happening anymore. And he was super sweet. He was like, I fed everybody. You're good. I just figured that you were really tired, so I thought I would let you sleep. And I was like, you're very sweet. Thank you. And so I let him sleep in this morning so that he could catch up a little bit.
Yeah.
But we made it. We survived. Oh, and I was right about group because we're always a week ahead of them.
We are. We called it.
We are literally a week ahead of them. So that like star thingy that I did, I don't know if we did it on camera, but the homework that we did was basically just to teach you that you can't, like, trust is not black and white, and
Right.
safety is not black and white. And so you can trust different people with different things, different ways, and different amounts. And I already knew that.
Yeah.
So
Yay for you.
it was boring and terrible. Oh, and then
I fell asleep several times during the therapy
during
session.
therapy, it was boring. And it's always like two people who talk.
Yeah.
Because they need this.
Yeah.
Like they need this.
Yeah, they're engaged.
And then
in
I'm like
participating.
bored.
Yeah.
Until I can pop on and be like, look, this is how I think about this, that has changed the way I think about this, that has helped me shift my thinking. And sometimes they allow it and sometimes they don't.
Mostly don't.
Yeah. But they did this week.
Yeah.
Which was interesting. So I talked about like trusting. I used my husband as an example and talked about trusting him differently.
Yeah.
And I was even like, friendships are like that too. Like different friends are there or like fill different gaps in our lives, I guess.
Right.
So not that we're like, and you can be for emergencies and you can be for fun and you can be for like, we got to go gossip about something.
Right, exactly.
No. But same thing, different day. And then I opened with my drama that had happened. And then I got an email from my therapist. And she was like, I was just checking in. Like, are you okay? Did you want to do a session? And I couldn't even email her back. I was like, I can't. I don't know what to do with this. I'm going to wait. We're going to see what happens. So I'll probably email her back tomorrow. So I took Thursday off. I really would love to take tomorrow off. But I don't know.
Right.
I want to because I need to. But also I know they need me.
Right.
So that makes it hard and frustrating. But yeah, that was my week.
Mm-hmm. Mine's pretty similar.
Yeah.
We had a passing away in our family. Jen's dad passed away right when everything started going down.
Yeah.
So we've been working on that.
Yep.
It hit her harder than she thought it would because they were kind of estranged from each other.
Right.
But it's still.
Which we can relate to.
Oh, totally.
I think a lot.
Yeah.
It's like you didn't realize you were going to feel that much or that strongly about it.
Yeah.
So it was surprising, I think.
Mm-hmm.
And was he on his way out the door?
No.
Or was this like very sudden? It sounded like it was really
He was
sudden.
he was addicted to drugs for a long time, and he was doing better, Like he'd gotten off of, I think, everything, and
Yeah.
he had a consistent job, and he was like bettering himself really.
Right.
And so it seems like it was out of nowhere, but probably had a lot to do with past
Right.
health
Like
damages.
heart attack or something.
Right.
Yeah.
So we don't know, but
it's rough.
yeah.
And it is, and it's rough when you're like, I didn't think I was going to feel that way about a thing.
Right.
And now I feel very strongly about the thing.
And then
So-
I learned stuff about my family that I didn't know. More family drama. And then everyone else was having problems at the same time. Like,
Yeah.
it all came on at once.
Yeah. It was, and Wednesday, when this all happened, it was a full moon.
Oh, yeah.
I was like, of course it is.
Oh, yeah. And then I had that friend who had an issue. Like, I talked about it. Yeah.
Yeah.
Like, just everybody was not having a good time.
No, it was not good. And I was like, this is summer. This is supposed to be like the break in the like crazy.
Yeah.
And this was like both shoes dropped at the same time.
Yeah.
Just cuz, I guess. Don't know. So, yeah, it was a week, and I would not like to repeat it. I would like to have a fresh week.
Yeah, move forward.
And I would like to have this week be a good week because I have to get on a plane next Sunday and fly out.
Yep.
But my husband is actually looking at tickets right now to go just fly out with me.
That'd be
and
nice.
He would just entertain himself at
But
the
be there.
conference,
Yeah.
and then we would at least be together, which I think would be good because
I think so. Like, it'd be nice to just relax too.
Yeah.
Not be at the house for once.
yes. Well, and I think change of environment I think is good for everybody.
Yeah.
So I'm hoping that it works out the way it is supposed to work out.
Yeah. Well, we'll see.
And then we'll just go from there and see.
It's like a reset.
Yeah. Well, and that's why like I rage cleaned the house this
Right.
weekend because I definitely did a clean house, hurt body.
Yeah. Yep.
And I still have not yet fully felt the consequences of my actions.
Yeah, no.
So we'll see how I feel later today. But my husband got me this new shirt. So those of you on YouTube can see my straight out of college in shirt, which I think is hilarious.
It's great.
I'm very happy with it.
Yeah.
He got me like 3 t-shirts and a bunch of really nice ice packs and like a shoulder brace, like the one that holds it toward your body, I guess. And then a hip brace and
So for my birthday, you got a bunch of stuff?
And yeah.
He didn't get me shit.
It was our anniversary, or it's our anniversary tomorrow.
That's cool.
So, and then he was convinced that it was the 15th, and I was like, dude, no, it's the 18th, and then it's the 10th of August.
Right.
Because we have a weird anniversary where we got courthouse married.
And then you had your ceremony.
And then my mother-in-law was like, you're having a wedding. And then we had a wedding. So we have the 18th and then August 10th.
Yep.
And so if one doesn't work, we usually just celebrate the other. But yeah. And he was really happy with what I got him because I got him like a really nice pro tweezer set for his 3D prints. And he's having a good time.
Good.
So, but I'm tired. And I can't start the school year tired.
Yeah, no, it's supposed to be restful times.
Yeah, so I'm going to be unconscious after our trip. That's all I know.
Yep. What is our topic for the day?
Ooh, we have some really good ones. So, we are going to talk about essentially like medical bias.
Right.
So we're going to talk about bias against women and BIPOC people. I don't like BIPOC because it's by Indigenous people of color. So they're not BIPOC people, they're just BIPOC.
Right. Okay.
Sorry. Grammar is like really tickling my brain today. I'm having a really hard time reading things and hearing things. So that's been fun.
Mm-hmm.
So yes, we're going to talk about the bias. And then we're going to talk, so we have a couple different like breakdowns. So medical bias on pain and emergencies, and then the bias with autism and ADHD with diagnosis and treatment, especially for women, because we present differently on different things. Because, wow, people are different.
Mm-hmm.
Amazing. So, one of the things that we were going to look at was this TikTok that I had saved. I had to pull it apart, like pull it aside, because I saw this and I was just blown away at the absolute audacity of this doctor. And it is of a woman who she's in the hospital. I don't know. Can we play it? Do we want to play it?
No.
Do we want to just summarize?
We can summarize.
Okay. So this poor woman is in the hospital making this TikTok, and she's talking about how she went into the emergency room with just awful, awful pain. And she had had kidney stones before, and so she was like, I'm pretty sure that's what this is. Can somebody please help me? I'm in so much pain. And they put her in a room. Doctor came in, pressed on her back, and was like, seems like kidney stones, and then left her there for hours, screaming in pain.
Yeah.
And puking on herself, and left her in her waist and without any kind of relief in this room for, I think it was 2 hours before the first doctor even came in and talked to them. And then it was, I think, total of 4 hours before the charge nurse came in and was like, what is going on? You've left this woman in here screaming in pain. What's happening?
Yeah.
And the doctor, with his human mouth, said, oh, she has a history of depression and anxiety. She's just having a panic attack.
Fucking panic attack.
Yep. And so this poor woman is screaming and crying about how she's not a drug user, and she's not just asking for drugs for fun. Like, she's in actual agony. And the charge nurse rips into the doctor. And so they finally get her kind of settled. And the nurse goes in and is like, okay, so what happened to your sample?
Exactly.
And
what sample?
They didn't even take a urine sample when she got there. And so she gives them the sample, and this poor woman is peeing like black coffee.
Yeah.
Basically. Her kidneys were shutting down. And they left her in the room, puking on herself and screaming in agony for hours with no relief. They didn't do their, like, what they were supposed to do.
Yeah.
The due process of any of it. And just were like, oh, she has a history of depression and anxiety. This is a panic attack.
Right.
I've decided.
I have a similar story, but it's not as dire as that.
Oh, my God. Just disgusting.
Yeah. Well, you remember when I went in and I had that plastic, like, back thing? It was like the rib thing that, like, it was meant to keep it closed.
It was ripping out.
Yeah, it was getting literally getting yanked out of my back, and it was to hold. It was like a suture under the skin, but it was plastic. It's supposed to dissolve. Didn't dissolve.
Nope.
And it got yanked on like 2 weeks post surgery.
Yeah.
Like, it got caught on my blanket. I sat up and it went thump.
Yep.
And it's like it was barbed and everything. Like, it's not supposed to move. It freaking hurt. And like,
yeah.
After
you
that,
had spinal surgery.
Yeah.
It wasn't like it was like a walk in the park.
No. So we went into the ER, and I'm like, I had to lay down in a really specific position to not be in pain, but I had to lay down.
Yeah.
And the first doctor that saw me was like, let me look at it, and he like messes around with it a bit, and he's like, okay, we'll do imaging, but there was a queue, and he left. Yep. And so we waited for 4 hours, and then they come in, like, they do imaging. I go back, wait another 4 hours. So we're 8 hours in, and my back is killing me, and I was sweating, and I'm like, tears are going down, but I'm like screaming, just
because we know better.
Right.
We know better.
Nurse comes in, turns right back around, goes out, and then another doctor comes in. He's like, you look like you're in pain. What have they done for you so far? And I'm like, nothing. All I've done is an image. And he was like, what happened? And I explained. He was like, okay, we're going to go get you some morphine. And then after that gets settled, we'll look at your results and figure out what to do. It took 8 hours to get there, though. Yeah. And it wasn't that they were backed up. They could have treated me like a human at any point. And I'm a dude.
Absolutely awful. And I feel like it's absolutely just so much worse in the emergency room because we know that emergency room doctors are like, they're pressed. Yeah. Right? They have so much demand and not enough help. And we know this to be the case, but they take that out on patients. Yeah. Which is not okay.
Well, they do the quick assumption thing too. Yes. It's like what you're.
Oh, they've decided.
What is that? There's that. It's one of the unhelpful thinking the assuming you know what people are thinking.
Oh, like the mind reading?
Right.
Yeah.
The mind reading.
Or overgeneralizing.
They do
That's
that
a big one.
to everybody.
Yeah. Oh, yeah. Oh, yeah.
Yeah.
And especially, and here's the big one, and this is what I hate, is the, like, you're a woman, so your reactions mean nothing
dude
thing. Summer and I were actually talking about this yesterday, because if you've been on TikTok, you've seen, or have likely seen, at least one TikTok about the IUDs and how those are done, and how they are excruciating to have put in.
Right.
Excruciating. And they don't do anything for you. Nothing. So there's no numbing, there's no pain relief, there's no nothing. Once in a while, they'll stick one Q-tip with a little bit of numbing just on the tip. But guess what? They're like, grabby thingy is going to, it's like getting a piercing.
Yeah.
On.
You want to know what's fucked up, though?
Huh.
For when guys get like a vasectomy, they get doped up.
Oh,
they numb the area a shit
God.
ton, and all they're doing is cutting 2 tubes. Like,
yeah.
You don't need to. A local would have been fine.
And they'll get a week off.
Exactly.
You know what you get with an IUD?
Nothing.
Jack shit.
Yeah.
Like, you will not have any time off, which is absolutely insane, because the first time I had mine done, it was awful. And they're like, oh, it'll feel like cramping. And I was like, that did not feel like cramping.
Yeah.
That was awful.
Mm-hmm.
And then I basically bled and cramped for 2-3 weeks.
No, that was anxiety.
Oh, yeah. Must have been. I was having a panic attack. Transient
Fucking
episode.
Jesus.
But, like, I had to work.
Yeah.
And so I'm at the movie theater and like on and off crying because standing hurts so bad. And it felt like that for like a week. It was horrendous. And then the second time I had it done, I almost passed out, which is saying something, because I have EDS and I'm in a lot of pain all the time. So if it's bad enough that I'm almost like passing out on the table, it's bad.
Right.
And you know, the biggest one, and this is why this happens, is because they went around teaching doctors that the cervix has no nerve endings.
And the doctors buy it. That's the worst part.
You have a bunch of doctors out there who are like, oh yeah, no, they're faking it. The cervix has no nerve endings. They can't feel any of this.
Oh my God.
And you're like, okay, I really feel like unless you've had it done, you don't get to say how it feels.
Right.
So shut up. But also, like, there are women out there who are like, well, I had mine done and it was fine. And you're like, great for you, Susan. Right. Other people have not had that experience.
No.
Your experience is not standard. You're not that special.
Mm-hmm.
Jesus. Oh my God. Yeah, the IUDs are, that's the big one where we're starting to like really see that disparity. And there are men coming on going, hey, I'm 2 days post-op from having a vasectomy, and I got 40 Percocet, 40 Percocet, a week off of work, and they put me on gas the entire time they were doing the procedure. And he was like, I'm 2 days post-op and it's like mildly uncomfortable.
Right.
He was like, I didn't even have to use any of the Percocet. I don't know what the heck. And he was like, and I was with my wife when she had her IUD done, and she said it was second to childbirth.
Right.
In the pain scale.
Fucking. I had a thought and I lost it. Dang it. It was really good. Oh, what were we talking about?
Vasectomies.
Oh, yes. See, and that's Jen and I had a conversation forever ago about not having more kids. We wanted to, and that was it.
Yeah.
And I offered, I was like, I'll just get a vasectomy. That's fine. And she's like, you can have a vasectomy, but I'm still getting my tubes removed.
Yeah.
And I was like, shit, that's dire. Like, that's going to suck.
Right.
Because, you know, for me, it's nothing.
Especially
It'd be
after
like,
you've birthed 2 children.
Right.
Like, is it really the woman's job?
Well, and I was telling her, like, it makes me look bad. Like, people are going to assume that I made her do it, and I was too scared to do it myself. But she really wanted it for herself.
Right. Which is fine.
Yeah. It just...
But then you have that whole group of doctors who are like, oh, you would like to have your tubes tied as a young woman with no children?
Right. No, that's against the fucking law of the world.
You need your husband's permission. Excuse me, what?
Yeah, right.
Oh, you would like to have a hysterectomy because you have horrendous cysts forever and ever? Or you have, what's the one? It's not cysts. Help.
No, it is, isn't it?
It's where the uterine tissue grows other places.
Oh.
Endometriosis.
Yeah.
But women with endo, like, hysterectomy should be a viable option no matter how old they are.
Right.
Like, if that is causing you so much pain, and guess what? They know if they have their uterus removed, they can't have children naturally. They are aware. Thank you.
Mm-hmm.
Stop it. Jesus.
It's ridiculous how different the experience is for each.
Yeah. Well, and it goes into exactly why we have to, like, play our cards so carefully when we are approaching new doctors and trying to make ourselves heard in a way that they're going to hear us. We can't just be like, here's my experience, and have somebody take us at our word.
Right.
We have to be like, here's my experience that kind of mimics that other's experience and what you already know. And yes, I've already tried all of these things that you're going to tell me to try first. Like,
do you think, or have you experienced it where women doctors are more sympathetic to, like, being called out for having a panic attack when you're not, like, or is it just a universal doctor thing?
I don't know.
That comes to, like, the arrogance of being a doctor.
I think it's probably a little bit of both, because especially as a woman in medicine, like, my gynecologists were all women, and there was not a lot of sympathy for the IUD.
Oh, wow.
They were just like, yeah, no, stay laying down. You might pass out. That's a standard thing that happens sometimes.
Oh, my God, dude.
And I'm like, what other procedures out there are like, oh, yeah, you might faint when we're finished?
No shit.
Oh, and Summer was telling me that when she had hers done, the doctor was telling her to stop making so much noise, basically. And there's a lot of stories like that where people are like, the doctor told me to shut up because I was being too loud or being too dramatic or whatever.
Oh, because it's women just being dramatic.
Exactly, with our wandering uteruses.
And hysteria.
Yes, we got that hysteria.
Fuck.
But we can't get the hysterectomy to match. Yeah, no, it's awful. I don't know, though, because I think it also depends on how supported female physicians feel in their workspace. Because you have that whole, like, well, I'm just like the boys attitude that happens. And that can be really detrimental. But if they feel supported, I wonder if there's a difference in how they relate to patients. Because I know on the whole, I've seen, and it's hard for me to say, I know a lot of people who prefer female physicians because they're more sympathetic in general and more like on the nurturing side.
I prefer a physician who's been through shit. Yeah. Like, seriously, like, all my best doctors are like, they either have the same thing I have or they have something similar.
Oh, that's fair.
Like, Dr. Chastain had hand problems. He had to have his hands worked on for his surgery. And, like, everyone else, they all, like, especially at the pain clinic, had chronic pain.
My favorite therapist, Dr. Shields, had chronic pain. Yeah. Chronic back pain.
See?
And problems there. But, yeah.
Is there a website for that?
I was going to say, what's the, like, how do you put that in the search box?
Oh, it's like, what you do.
My doctor needs to have been through shit.
when you do the first, like, intake or whatever, you have to be like, how was your childhood? Was it normal? Have you had any weird accidents? Do you have chronic pain? What are your thoughts on anxiety?
Yeah.
Get it all worked out.
Right. I don't know, though, because I'm definitely someone who prefers male doctors, just because there's something about the way that I communicate that works.
They're better. More straightforward, it seems.
Yeah, and I think that works more in my favor. Because that's how I prefer to communicate. Right. I don't want to be like, oh, and then I felt a way. Like, no, I just...
Right.
I need you to do a thing. That's it. Because the one time I had the female anesthesiologist, bad things happened.
Right.
Did not like. Do not recommend. But obviously it's because she was like, oh, I'm going to make sure you're not in any pain. And I'm like, no, just make sure I can get through this surgery okay.
Right.
Like, I don't care. Let the pain be there. It's going to prevent me from hurting myself a lot better than, like, let's put a nerve block in there and then see how she be free, you stoned ass human.
Right.
with one functioning leg, but also you're too stoned to realize that you only have one functioning leg. Also fall down the stairs a lot.
Mm-hmm.
Go. That set my recovery back a lot. Did not like that. But I know other people would appreciate that and appreciate that, like, they tried really hard to keep me out of pain. No, it's fine. I'll be in pain. It's okay.
Yeah.
Just fix it.
Oh,
I don't know. But what are your experiences with trying to have your pain understood? What does that look like when you go in and you're like, because I know we all do it. We all go in if we ever have to go in and we're like, okay, here's like the script that I have to put together to communicate to them.
There are numbers too that everyone uses. I've noticed like in TikTok and stuff. There's how bad is it? And it's pretty bad. You're at a 4. People will always say 4.
That's funny.
Right, like right.
4 and 7.
Like it's a 4. I was gonna say it's either 4 or 7.
Yep.
7 being the it's pretty bad, and then 4 being the I'm fine, I got this.
Yeah. Like, it's uncomfortable, but it's okay.
Right.
That's all right.
Because anything under a 4 doesn't reflect your everyday life.
Right.
Because your basis is 4.
Right.
And you need to convey that. And then 7 is, I don't want to be an attention seeker. I'm not trying to be dramatic, but
also, could you help me?
Yeah, it's noticeable and it's affecting my life daily in bad ways.
Yeah.
It's never. I mean, I've been a 10 one time, but that was back surgery stuff.
Yeah. I think I was pretty close to 10 coming out of my first hip surgery.
Yeah.
Because something in my abdomen had like gone funky.
Right.
And I was like crying and they were like, you can have more pain meds. And I was like, no. I don't want to waste them. And they were like, no, you can have more pain meds.
I like when we get stoned on like the anesthetics, we're like, no, we can't. No pain meds. Why? I just stigma. I don't know.
I don't want you to think badly of me after
really, that's
this
what
surgery.
It is. Like, I don't like it's gonna even matter. They won't remember you in like 3 days. But
oh my god. But we both do it. We're both like, it's fine.
Yeah.
I'm good. It'll be better.
Oh,
later.
totally.
It'll be fine.
And then when they offer, I don't know how to say yes.
Right, because you're like, how do you be like, I'm enthusiastic about this, but also we gotta play it down.
Right.
Gotta play it all down. And for me, like, because women are hysterical, I have to play everything down.
I was gonna say it's a way different for you.
Be taken seriously, but I also have to be. I don't know. It's like, sorry.
How dare
I just
you?
keep kneeing him repeatedly.
If anything, look at this. I'm man spreading.
Oh, you're fine. I'm chair sitting wrong.
Yeah.
Wrong sitting. But like, I can't go in and be like, oh my god, it hurts really bad, because they're gonna be like, ugh, another one.
We couldn't do that if we didn't have EDS.
No,
that's just not who we are. We're not the type to be like, oh no.
That's a little too vulnerable.
I'm
gonna cry by myself, not with you. Thank you.
Right.
Like if I'm crying, I'm crying alone.
Mm-hmm.
Good. No, but if I have really horrible pain, I gotta like nudge toward it, I guess, and be like, this hurts pretty bad when I do a thing and it's affecting this way and it's affecting this, but I mean, it's not always blah blah blah. But I have to like, I don't know, I have to like qualify and disqualify over and over and over again until they think it's their idea.
Yeah.
Basically,
you have to con them into thinking it's them being brilliant.
Yes.
Not you suggesting it.
Right.
I don't see video if you're trying to show video.
We're not.
Okay.
We're just doing our podcast.
I was just going to add that with your back surgery, I had to do it for you. Because you wouldn't press the button.
Yeah.
Yeah. Well, and Jen, were you the one who picked me up for hip surgery?
Mm-hmm.
So you remember when I was like, I was in horrible pain, and I just sat there in horrible pain until they were like, you can really have a medication.
Yeah.
Yeah.
You're allowed. It's okay.
Special guest Jen, everybody.
Yep.
I'd have to intro you.
You just popped in the middle.
Well, I raised my hand to speak, and then I was ignored, so I was like,
It didn't show.
I have moderator powers, so I'm gonna do that.
If Crystal's been doing that, I feel bad because I've been trying to keep my eye on it, but I didn't see anything.
I was looking at like the chats, just keeping an eye there.
Okay.
Because if we miss something.
Yeah, because Crystal's story is pretty.
Okay, it just shows me the request menu.
Mm-hmm.
Yeah.
I think we should do Crystal's story in the part 2 because that gets into that whole other piece of that.
If she's up for it.
Yeah, we could definitely do that. Because our next, what?
No, she bails.
Our next kind of topic within this topic is going to be that autism and ADHD and how that is all treated within the medical systems.
Okay. Yeah.
But yeah, I don't know. And then emergencies, like emergencies and how doctors view them versus like with men. If a man comes in and he's like, oh, doc, like up here on my right side hurts really bad and I think I'm going to like die. They're like, oh, it's an emergency.
Right.
Get that man some like morphine. Woman comes in and she's like, oh my God, this hurts horribly. They're like, are you sure you're not on your period?
It's always that. It'll always be. You're on your period.
You've lived this long in your own body and you don't know what your own period feels like. Clearly, because women are stupid and they know nothing. Go ahead,
When
Jen.
I was at the emergency room for a migraine, I couldn't get it to go away, so it was like day 4.
Oh,
I went in and they were like, we're gonna do a pregnancy test, and I was like, if you feel like you have to, go right ahead, but I don't have tubes.
I love that.
you have a headache. You must be pregnant.
You're preggers for sure. But I had a tube ligation. You're double
I
pregnant.
don't care. I'll make you pregnant by the end of this visit.
Well, it was.
Oh my
it
God.
was a woman.
Oh God. Oh.
It was a woman, not bad porn. She looked like surprised and was like, oh, well, I have to run it anyway, but glad I can just mark it as negative.
Right.
Mhm.
It's just so frustrating. And then my favorite times are the ones where you like shock the doctor because you know exactly what's going on with you
Yeah.
and you know exactly what you need. Like if I walk in and I'm like, I'm having a dysautonomic flare and I need fluids. The end. That's it.
Right.
The end. And then they're like, she's not asking for drugs. I'm confused. You're like,
Yeah.
I really just need salty blood water, please. Put it in my veins.
Yeah.
Thank you.
That's why I like to, when they ask, what do you expect? Because you know that's a loaded question.
Oh, yeah.
But I love that one because I'm always like, I just want it to be better, or I just need to know what's going on. Like,
Yeah.
I need to know it's not dire, and then I'm fine.
Well, and that's exactly it. Because when do I go into the urgent care? When I'm like, this could actually be a thing.
Right.
And then you go in and you're like, I'm pretty sure it's not serious,
Yeah.
but I needed to just make sure.
Mm-hmm.
Once I know what it is, I'm good to go. But how long did I fight the esophageal spasms with them telling me that I was having panic attacks?
Right.
And then I got to a point where I was like, no, I can literally ground through the whole thing and it's still happening. It is still happening. And they were like, migraines. And you're like, what?
Do they just pick it out of a hat, you think? They're
It's
just like,
periods, migraines, panic attacks.
I can't even.
That's it. That's all women have.
Or
That's
when I
it.
went to the ER, like almost a year ago, because I was like, no, I know this is a kidney stone. This is a kidney stone. So we went in. Oh my God. He wasn't listening to me, obviously, didn't believe me at all. And was like, well, we're going to get you scanned and we'll see. And I was like, great, let's do it. Like, this fucking hurts.
Yeah.
Please help.
Yeah. Yeah.
3 hours later, he comes in and he was like, yeah, you're right. It was a kidney stone. It looks like you passed it though, so you're good to go.
Also, I don't care if you're in pain. Bye.
Yeah. They didn't do anything for it.
Oh my God. And teeth, like dentists, horrible.
Oh my God.
Horrible. Either they're giving you like 90 Percocet for absolutely no reason, Or they're like, let me dig a hole through your face and into your sinus and then offer you nothing.
Yeah.
Ta-da!
No, she offered like her condolences.
Condolences.
I'm sorry that you did this to yourself.
Oh, and did you know they don't even count the number of Black women who die in childbirth because it would be just off the fucking chart.
Yeah.
Because they are ignored. So God forbid you are a woman and a person of color, because they are not listening.
Right. No.
They're not listening. And it's terrifying, the people that they're like, oh yeah, we sent them home and then they died.
Right.
Because, oh, lo and behold, it was an actual emergency. That they were like, oh, it's just a panic attack. Oh, they're doing it for attention. Oh, it's for the medications.
Mm-hmm.
And even when you're like, I don't even need medication.
Lady, that black doctor lady over COVID.
What?
Do you remember that?
No.
What?
Yeah, so there's this black lady doctor, and she was treating people with COVID and then caught it, and I think her family won a lawsuit against the hospital because they didn't do anything. She made a TikTok. She made a TikTok from her bed, like, they're not treating me, they're ignoring me, they're setting me up to die. And she died like a day later.
Yeah. Did you know that the textbooks, because, you know, America and racism, literally taught that people of color feel less pain than white people do. And so we have this entire generation of still practicing doctors.
That's the scary part.
Who
It wasn't
are
that long ago.
Still teaching younger doctors that people who are not white feel less pain, so they're fine. And also
bullshit.
that women are
have
hysterical.
A lower pain tolerance.
Mm-hmm.
Which is insane, because who gives birth?
So,
No.
you know,
Right.
when a guy is expressive about being in pain, it must be really serious.
Right. It's got to be massive, like
Right.
crazy. But only if you do it the right way, at the right time, with the right doctor, for the right reasons.
Yeah. It's true.
You got an ego stroke while you're there. It's ridiculous. Are you wanting to take a break?
Yeah, it's break time.
Okay. It is time to go on break. What do they need to do?
Jen, do you know what they need to do?
Fucking hydrate and take your shit.
Jen is spicy today. But yes, hydrate and take your meds.
Yes.
Eat some food.
Take a break if you need to.
Yeah. Enjoy to the day.
Yep. Get some sunlight.
And be good to yourself.
Yeah. You deserve it. And I'm going to continue saying it because apparently a lot of people need to hear it on a more continual basis. You are and always will be worth more than you can produce or do for others. End of story. Ta-da.
Facts.
There you go. It's out there now. I'm not taking it back. It's yours. You keep it.
All right.
All right, my friends. We will see you in a moment. Bye-bye.
Bye.
Fantastic Pains now has merch. I know we've been promising it for a while, but it is here. You can find our stuff at fantastic-pains.creator-spring.com. We have t-shirts, hoodies, leggings, wine coolers, I guess you can call them, and my very favorite backpack. So take a minute, go check us out.
Welcome back. How was your break? Ours was very nice. We went outside, enjoyed some of the heat, and then we stopped enjoying the heat and came inside.
The pavement was hot.
Yeah.
Very, very hot. It's been like an oven here lately. Like, the dysautonomia has been crappy.
Not in our office, though.
No, it's super chill in here.
Yeah, I love it.
I love the studio so much.
We're going to do a studio tour.
Yeah.
It's not big, but it's reached a point where I think I'm happy with it.
Yeah. It's really cool. I like it a lot. Like, there's nothing else I can imagine putting in here that would be like, this is going to make it all better.
Right?
No, because we're amazing now. Pro setup for our nonsense.
Mm-hmm.
All right. What are we going to talk about this half?
Oh, we're going to do more medical bias, but in different ways.
Yes.
We're going to talk about the presentations of ADHD and autism for just girls.
Yeah.
And how it differs and why they get missed a lot.
Yes. Because I think that's a big thing. especially if we're talking about medical bias,
Yeah.
there's a huge disparity in diagnosis and early intervention, especially when it comes to autism. Autism is the big one where like early intervention counts.
Right.
Big, that counts. And if they're missed, then they are left to their own devices, and we grow up trying to cope and not understanding why we need to cope. So we're going to talk about what some of those early signs are, and why they are different from with our boys. So first of all, we have ASD, autism spectrum disorders, which it's pretty well known that our girls are missed at a great number.
Yeah.
A lot of people are not diagnosed until their adulthood. I actually was working with a music therapist who was diagnosed like a year ago.
Wow.
Which is crazy. And she was like, no wonder I get along with these kids so well. And I was like, good for you.
The ratio, I'm looking at it on the page, 3 to 3 to 1.
Right? Isn't that insane? So one of the big things, this down here, this highlighted section. So our male presentation is a lot more obvious, I guess. Whereas females with ASD tend to present with less restricted interests and repetitive behaviors. So they are more what I would call internalized.
Oh, yeah.
So as our male population is more externalized with those behaviors, our female population blends in a little bit too much a lot of the time. And so they stand out less in society as well as on screen and in diagnostic measures. Fear of those repetitive behaviors makes ASD appear in a different way, often more subtle than it is considered to be the norm. And this is the other big thing. As we are learning more about our culture and how it's built on lies, it is a throne of lies, is that all of the medical measures are standardized for boys.
Yep.
It's all standardized for boys.
Yeah.
So if you present differently because you're not a boy, you're often missed by those measures. So where did you see? You saw 3 to 3 to 1. So sorry, I have to find like
ASD is diagnosed more often in males than females, with a recent study suggesting a ratio of 3:3:1.
Yep. Which means that our male population is more heavily diagnosed, and it really is. It's because they have more of those outward behaviors, a lot more eye contact avoidance is much more apparent. Social avoidance is a lot more apparent. That like parallel play piece where they're not super interested in interaction. We also see a lot more like stimming, so those repetitive behaviors, those like ritualistic behaviors, whereas our female population tends to hide it a lot better. And that's not to say that our female population does not like they go without stimming,
right?
But those stims might be a little bit more subtle, or they are reserved for times when they are alone,
right?
Which again, we can miss them quite a lot.
Yeah.
So our friends with autism who are missed are often put through quite the ringer when it comes to diagnosis at an older age, because once you're out of childhood, the coverage is different.
Right.
Because they're like, oh, you made it this far, you're fine, you don't need the diagnosis. Or you're going to pay like $3,000 for your diagnosis.
Yeah, exactly.
Which is crazy.
And you need it for accommodations, like
yes.
for jobs in general. Like having that is huge.
Right. Well, and honestly, it's the same as what it is for us, where appropriate care matters.
Yeah.
And appropriate care with context matters. And not only just the appropriate care, it's good to know yourself, right? Like it makes a difference to be able to take things and put them in a retroactive lens. I'd be like, all of this childhood stuff that I punished myself for makes sense now suddenly. We also have the same kind of disparity, I think on a lesser scale for ADHD. We're starting to learn a little bit more when it comes to ADHD, but our women and girls can have any of the following presentations, and presentation and symptoms severity can vary across their lives. However, both research and life experience indicate that girls and women most often appear to have the inattentive presentation. So, in short, basically what they're saying here is that the hyperactive presentation is much more often seen in our boys.
Yeah.
And that leads to my point down here where we often, for our male population, it's much more obvious. You can see the ADHD there, right? And then they are more often medicated at a young age.
Yes.
Because it's inconvenient to be hyperactive.
Right. Children are meant to be seen, not heard.
Yes.
It's one of those.
And if you can't survive in the factory school setting, better medicate.
Yeah, absolutely.
And I think Crystal and I were talking about this, or we were all talking about this earlier, where it comes to, like, they don't teach those self-management skills at those young ages. And they are left for us to discover in therapy as adults. So a lot of the time, our boys are really early medicated. Our girls are can be really talkative, but usually all those behaviors are seen within a social setting.
Right.
So inside of socialization, you see a lot of symptoms and signs that could point to ADHD. But when you're looking at like the factory setting, you're going to be looking at girls are performing higher.
Right. Oh, yeah.
So it makes it interesting when you look at it this way, because societally, it's different. And it's not necessarily, I don't think, the sex of the child, but the presentation and the socialization.
Yeah,
it's different. It is different, and it's hard. And our girls are getting skipped, and they fall through the cracks, and we miss them. And so unless they're having really severe symptoms, they're not flagged as young kids. Because generally what happens is if you're not seeing those behaviors like at home and it's not tipping that hat, the school is the one that puts forth the like referral and recommendation for evaluation.
Okay.
But if they're not presenting, they're not being seen and not being flagged. And so if parents don't know what to look for, it's hard. You don't know that you're looking at ADHD. Or you don't know that you're looking at autism.
Especially with how social this is. I'm reading the page, but being outwardly that exuberant, like, it's weird.
Yeah, isn't it? It's so fascinating. And for me, being a SPED teacher, I'm always super, super interested in this stuff because it's important to best serve our populations. Yeah. And if they're not if we're not meeting their needs, they're not going to be meeting us at the table when it comes to doing work, right? And education and schooling. And so we see a lot more like internalized behavior, and that can come out like the same kind of impulsivity, but on a different scale. So we might see like self-injurious behaviors, right? Like self-harm. We might see difficulty. This is a big one. Not talking in class when you've got them and a friend, and they're just they can't, like, you know, Jen, like you can't stop her in the middle of a sentence or a thought.
If she can't get a thought out,
so
it's
if you're
the end
like,
of the world.
Please stop talking, and they're like, hold on, let me finish this thought real quick.
Yeah.
You're looking at ADHD most likely. Not always, but and girls tend to compensate more independently. Whereas because boys are identified earlier and medicated earlier, which can be a problem in and of itself if we are medicating so early, because this is what bothers me and frustrates me and is fascinating and I question a lot, is like they don't like to medicate boys for bipolar, right? Early on. They want you learning coping skills. Whereas with ADHD, it's backwards.
The other way, yeah. They don't want you to learn coping. They want you to take the meds.
They're like, here, take these meds so you stop being annoying.
I wonder how much of that is pharma related. You know, like maybe bipolar meds aren't as lucrative.
There's got to be like a standardized practice within it.
Yeah.
Because we know there's like protocol. There's always protocol.
Yeah, for everything.
Always protocol. So let's see. Treatment for ADHD in women and girls. No, I really just want to see. Let's see. So difficulty sustaining friendships, self-harming activities, adopts compensatory strategies. So leading to working 2 to 3 times as hard as her peers in order to be equally successful. And so this can bring on like crazy frustration because they don't understand why it's so hard for them to do the same things that their peers are doing.
Right.
And this gets so much worse when you think about our twice exceptional kids who maybe have ADHD, but they're gifted somewhere. And now they've been labeled gifted, and now they have to work 2 to 3 times as hard to maintain that gifted status. And if they lose it, then failure, right?
Right.
Big failure, sad failure.
Oh.
And then you wind up with like low frustration tolerance and unwillingness to attempt new things because they might not immediately be good at it. These are kids who do really well when you give them like hands-on activity.
Okay.
So if they can learn it as you're teaching it and apply it as you're teaching it, they tend to succeed a little further in my experience anyway, because they're putting those skills directly to use. And so you're filling in kind of that gap of, I need to fidget, I need to do something.
Yeah.
I can hear you speaking to me, but it doesn't mean jack. But if we can do like cooperative learning, they tend to do better.
Wow.
Isn't that crazy?
Yeah.
But it's just, it's insane. And we don't think about it. Like our whole society is built in this like, oh yeah, we do our best to blah, 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 blah. But also we're missing tons of kids. Tons of them. Letting them fall through the cracks.
It's got to be frustrating too, especially if your doctor or whoever you're working with doesn't believe in it or doesn't think your child qualifies because they're not acting that way at that moment.
Right.
As a parent, that would just drive me fucking nuts.
Oh, yeah.
Having to battle a doctor to be like, no, I see these behaviors all the time.
Yeah. Well, and then you have the co-occurring depression and anxiety.
Right.
Because it takes so much effort to keep up.
Yeah.
And they don't understand why. And that's frustrating. And then you add that like gifted piece. And then they're like, this is really frustrating and I don't know why. Because apparently I'm super smart. Why can't I do this? And they tend to burn out pretty quick. So they may maintain that gifted status through high school, but they tend to struggle really hard when their compensatory skills are not enough to get them through like college courses.
Right.
And so if they, like we have these kids burning out, and that mainly what we see with those burnout kids is major depression and anxiety.
Oh yeah.
And that anxiety I've seen lead to dropout over and over and over again because they can't.
No, and they see themselves as a failure.
Yeah. And they don't know why.
Exactly.
And that's hard. Especially when you add like, obviously with ADHD we have a difficult time with executive functioning. And if we're not teaching those skills explicitly when they are young, how are they supposed to build those like supports in their lives? And then you put them in an independent field and they're like, I don't know how to do this.
Exactly.
Like, I don't know how to do anything generally. I'm like, I just do it and hope for the best. I don't know. So yeah, super interesting. Very strange kind of presentations, and not strange presentations, but differing from the standardized diagnostic criteria.
Right. Well, it's like everybody needs to be updated on the fact that girls present very differently.
Yes. Oh, absolutely. And like especially for autism, like we have tons of people being diagnosed in their early adulthood.
Yeah.
And now we're seeing that kind of trend of thinking of, oh, it's trendy to diagnose.
Right.
Or it's trendy to self-diagnose. And that's obnoxious.
Right.
Because those people live in a totally different world.
Right. Well, and to take that away from somebody, someone who's like, oh, I found a reason why I might be this way. Like
Right.
it would solve all the fucking problems I've had.
Mhm.
It would make everything make sense.
Yeah. And then they're
for,
like, oh, well, you can make eye contact, so you don't have
right. Or, you know, you saw this on TikTok, didn't you? You
Right.
diagnosed yourself on TikTok. Like,
Right. Right. No, there's a reason TikTok finds you with it.
Yeah, true.
Their algorithm will tell you things about yourself you didn't want to know. But yeah, no, it's insane. It is insane. And that's really what it is, because we have, and even in education, I had a kid who ASD boy, but was so witty and so funny, and like sarcasm had it. And I had an PT, so physical therapist was there one day, and I'm talking to her about this kid because he's in the hallways a lot. He was put in BD when he didn't need to be in BD. He needed autism support. And she was like, well, are they sure he's autistic if he understands sarcasm? And I was like, dude, bro, they don't all have all the same symptoms.
Right.
And if that's what you're using as your basis for qualification, that's like eye contact. Girls are way more likely to give you eye contact.
Right.
Or fake it. And they learn to fake it really early.
Oh, yeah.
Where boys are going to like outright avoid you. And they will. At least when they're like young. But oh my God, it's crazy the things that they miss and the things that they use to qualify. And especially like ADHD, they're like, oh, they're not hyper.
Right.
They're not hyper, so it's fine. You're like, okay.
I still have this mental problem.
But also,
they could be treated. I could learn things. I could use things.
Right.
No, you're not hyper. Don't worry about it.
No.
You're too calm.
Yeah. And I just don't understand why they're not teaching those compensatory skills early.
Right.
Why are we doing this backwards in all kinds of different ways? And it doesn't make sense, and it's detrimental to our kids. And then to turn around and tell them that they're self-diagnosing, and it's just trendy. And you're like, is it though? Is it trendy to be autistic in a world that doesn't understand autism?
It's trendy to just pick up diagnoses in general, right?
Right.
Like, oh, I have EDS and POTS, and no, you don't. You're just
MCAS.
You're just
like,
saying that.
I swell up to fake it. Yeah, like I rub gravel on my face so that I swell.
Right. Like I wait till I'm all alone and then I start having these symptoms for me. This is for me time.
No, it's trendy. It's trendy. Yeah. So the implications for under or late identification are enormous and deserve empirical attention in an effort to improve diagnostic methods for ASD in females.
Okay, so they still need to work on it.
Which is sad because they still need to work on it.
Right.
Like, they don't have the empirical data because all of these kids are sliding through the cracks.
Mm-hmm.
And it's the same thing that we've seen over and over again, where you have people coming out and being like, oh, it's overdiagnosed. And you're like, but it's not.
It's not like there's a finite amount of ADHD to go
Right.
around. Like, oh,
there's only 40,000 ADHDs.
There's too much.
today.
We don't have any more. Sorry.
No more ADHDs. There's too many now. And this was written 2020. So up to 2020, they still didn't have enough empirical data to have actual statistics on diagnosis and have different criteria pulled out for diagnosis, which is just fascinating. I don't understand why. Like, there should be 2 sets of criteria and like different presentations, right?
Yeah.
We see it in ADHD. We have like ADD, right? And then you have ADHD, and those are 2 presentations. Why can't we do the same thing here?
Mm-hmm.
But I think it's partially because diversifying diagnosis takes away from their, like, I don't know, their like on paper setup.
Right.
Right? Like the DSM-5. If it's not in the DSM-5, it doesn't exist. You're like, oh, this is not serving everybody well. And then if you look at ASD in people of color, there's a lot of disparities there too.
Right.
Because not everybody presents the same way. They just don't. It doesn't work that way. That's part of the whole neurodiverse thing. They are divergent and diverse. But no, they're all the same, and we should treat them all the same. And if they don't present the same, clearly they don't have it. But also, please don't self-diagnose. Are you crying?
No, I had a thing on my face and I couldn't. It felt like I had a hair. It was like right here.
Oh, I got part of it. You have another one right there.
Thank you. It was driving me nuts.
We got it. Teamwork.
Ah, okay.
But it's insane. And this is actually, at least they're acknowledging the underdiagnosis
Mm-hmm.
of AD or ASD in females. And they're saying lends itself to a population of women who end up wondering what is wrong with them,
Mm-hmm.
which is exactly what we've been talking about here. And how can you have a full society full of people who don't understand themselves, don't understand why the world is so hard and the expectations of others are so hard to manage?
Yeah.
And then wonder why there's like mass depression.
Well, we were both there. We had the same problem. Like, why can't we handle normal everyday shit that everyone else can?
Right.
And then the depression that comes with that. It's the same thing.
Yeah. And then we wonder about like self-harm and the rates of self-harm, and then suicide attempts and impulsive behaviors and self-criticism and shutting down and isolation.
All because someone couldn't tick a box.
Right. Which is interesting because today we were exploring the EDS forums and all we were seeing was stuff about diagnosis.
Yeah, new people that were wondering about how to get diagnosed or what to do with it.
Right. Or like, I have this one page with all these boxes to tick.
Yeah.
But like, what if I'm missing one? And then you have one that was like, the sibling was diagnosed HEDS. And they were like, okay, but the other sister doesn't have as many qualifications. And
right.
You're like, now, give it a couple years.
Right. She's young.
Yeah. Because, well, and the other thing is, like, I didn't have papules when I went to get diagnosed because I was skinny.
Mm-hmm.
Now I do. I didn't have the knee when I went to get diagnosed, and now I do.
Yeah.
So that doesn't mean I didn't have EDS before. I've had EDS the whole time.
Yeah.
But the way that we choose to qualify things is absolutely insane and does not serve our kids well at all.
Well, think about it. There was that lady who got diagnosed at 51.
Yeah. Can you imagine, like, wondering what's wrong with you
for that long?
Your whole life and just being like, okay, I guess the problem is me.
Right.
I must be the issue.
There's so much self-blame, too. Like,
yeah,
what it does to you psychologically when it's, oh, I'm faking it. I gotta be because everyone else is fine and I'm not.
It's all in my head.
I'm either weak or making it up.
Yep.
Hate it.
It's all in my head, or I'm crazy. Even in this article, they talk about adults with high-functioning ASD are also at great risk, increased risk of suicidality, which is exactly what we were just saying. Because, duh, of course they are. And it's so frustrating to live in a society that's like, there's one on-paper type of person. Oh, yeah. Right? Like, you have a standard human, and it only looks like this.
That was bothering me. I was thinking about this yesterday or the day before, that there's a template for normal.
Yes.
But nobody fits it.
No.
So how is that normal?
Well, okay, so the template for normal is white male.
Yeah.
That's the template for normal.
Right.
And then nobody else fits it, and then we wonder why.
Well, and I'm just saying, like, everybody has something, it seems. Like, some sort of mental something.
Right.
Because it's not all the same. It doesn't make you, like, crazy.
Well, because brains are not standard issue.
Right. So it just really bothers me that they think that out there are people that are just normal. I don't think there are.
Well, and here's the thing. Like, we talk about nature and nurture, but we know that nurture can literally change the chemistry of your brain.
Right.
We've talked about ACEs in the past, which are adverse childhood experiences. Check out this study. I think Kaiser conducted it. But they talk about adverse childhood experiences and how that affects not only your brain, but your body. And so, of course, nobody's standard issue. There's
Yeah.
a whole
I want to meet
Cascade.
standard issue human.
right.
I want to meet this Ken doll of a person who's just, I'm a normal man. I'll use my credit card.
Kenneth, we would like to meet you. The perfect human.
Yeah.
Actually,
Yeah, I don't have any problems.
right?
I eat food and digest it.
And
What a
poop regularly.
fiber.
Once a day. Twice a day.
What's a headache?
What's a headache? He would cry if he had a headache.
Mm-hmm.
He would be like on
Little
the ground.
baby. Little
He's
boo-boo
never
baby.
felt anything before. He went to the ER for an ingrown toenail.
Ugh.
This Kenneth, you know.
I just did foot surgery on myself last
That's
week.
why I had to bring it up.
And I didn't feel it. It was great.
No.
But it was really ingrown. Like,
Well, because you didn't feel it.
oh, it was bad. It was huge. I was so blown away by it. I pulled it out. I was like, Jen, look at this. My feet have wings.
You're just growing roots into your toes. Yeah.
Yeah.
Yup. Oh my god, it's ridiculous. And yeah, you're right. Like there's one template for normal and it doesn't make any sense.
It doesn't fit people. I'm just saying.
It's just because people are different.
Mm-hmm.
They're different. But dang it, if we didn't need to like go the accommodations route and we could just all be people doing people things and having people hard times,
Yeah.
it would be different. But because people with high functioning autism are expected to function in the world, we need to help them get their accommodations, their appropriate accommodations.
Yeah. Well, they deserve it. It's so unfair to put them in a world where nothing works for them the way
Yeah.
it's supposed to.
Right.
Like, here's a whole system. This is a job. You're going to work the job. You're going to have to behave like a normal person, though. Can you?
Remember, what was it? I think it was Lou said. Help me find the words. I can't find them.
Oh, what did Lou
Oh,
say?
it was like, okay, so this world is built for type A. And if you're not type A, like if you're type B, erase B. That's your first step. We're going to
and
erase
add
B.
the line.
And then we're just going to turn it
To
into a
an
nice
A.
A.
Yep.
Go
Yep.
forth and be an A that's not an A. Oh my God. So frustrating. I'm like, can we please break away from the white man's world? Especially because the white man's world was designed like more than 100 years ago.
That's the real killer.
Yeah, considerably. Like, if you think about it realistically, we've made very little stride in progress from the white man's world of 200 years ago.
We're going to lose a lot of subscribers.
I'm not sorry. I'm
I was going to say, as a joke, because we have zero white male audience. I mean, there's got to be
No,
some
they're
that's
gonna
like
come
three
and
of
give
them.
us hate. Maybe that's what they'll do.
But
They'll
there's
follow
no,
us for hate.
there's no boy representation still.
I found some on the groups. when I
Yeah,
was
we found
posting nice
one.
things.
We found
Yeah.
one. One to like 1,000 girls with EDS, as far as I can tell.
Well, and that's another disparity, right?
Mm-hmm.
Like, men are less likely to seek treatment when it comes to something like that
Yeah.
because it's not acute and you're not crying, so therefore it's not doctor worthy if you're not crying,
Mm-hmm.
right? I don't know. And then at the same time, they're less likely to, I don't know that this is 100% true, so bear with me. I'm a human being sitting in a chair. Don't know what to tell you.
She's not a mortician.
I'm not a mortician. Get with the program. Since they're less likely to seek care and women are more likely to seek care, there's also a standard of like tough it out.
Oh,
within
yeah.
The male type,
Yeah,
right?
yeah.
Where, yeah, you're not gonna like be in a lot of support groups because that's vulnerable. Don't want to do that. And you're not going to talk about it because you don't want people to know about it.
I wonder if there aren't catfish out there, men that are using women profiles so they don't get like, so they can like sneak in
Maybe.
and relate and
Could be.
oh, there's got to be a catfish.
Right? We need to teach our boys that it's okay to not be okay.
Yes,
Right?
took me a long time to learn that.
And then we need to teach our doctors that they suck.
You suck.
That's it. We're teaching boys that they're okay to not be okay. And then we're teaching doctors to freaking update your knowledge.
Yeah.
Google should not be better at this than you.
You also need to be open to learning if you're going to be a doctor.
Right.
That I'm not going to check that fact
Oh,
because
yeah.
I didn't read it in a book.
I went to school. I don't need to Google my information.
Yeah, but it's quicker. It's right there.
And my information came out of a book that was written a long time ago.
A dusty tome.
Right.
The one that still talks about
You're like,
women being witches.
The wandering uterus.
Yeah.
Hysteria.
Oh my god.
Oh, history's embarrassing.
Just a bit.
Are you ready to call it?
Yeah.
You're looking a little sleepy.
Very sleepy.
Yeah.
I don't know why. I'm
It's
not going
okay.
to sleep. I'm going to lay down and then be like, let's do this.
I know. I'm going to be in the same boat here in a little bit because I'm going to go home and my husband's going to be like, let's talk about selling our cars. And I'm going to be like, no, thank you.
Well, good to have a conversation. At least he didn't do it.
Please no.
He's bringing it up to your attention. He's not doing it without
He
you knowing.
wants to get a Jeep.
Ooh,
And I'm like, I just want
a
a
car?
car.
I'd like to go vroom vroom.
I like that it goes from one place to another place.
Yeah.
That's about it.
You look really good today, by the way.
What?
Your eye makeup looks really good
thank
today.
you. I hope it shows up there. I don't know. I'm learning how to girl. I'm figuring this out one step at a time.
Yeah.
I'm trying to figure out my color because in the summer I change colors entirely.
Mm-hmm.
Like go back and watch something from like December and then come back and watch this because
Do it. Wait, don't do
I'm
it.
a brown person.
Season 4 is the only season that matters.
I said December. I didn't say like season 1.
It's true. It's true.
You could if you wanted to. Just don't.
Don't do it. It's a trap. All right. We got to go.
Okay, friends. Thank you so much for hanging out and coming along. I hope this was informative and gave you something to think about. And also, I hope it takes some of the shame out of struggling because it's not your fault that the world is not built for you.
Feel free to struggle.
Yeah, it's not built for most people, actually.
Mhm.
So, in the meantime, be kind to you, be kind to others, and we will see you in the next one.